Seniors are among the highest at-risk age group in the coronavirus pandemic, and that means a lot of them have been staying home with their families as they try to avoid the
Well,
crowds.
sometimes senior care can become overwhelming for loved ones. It's tough for a lot of families, but there is now a local resource that is offering their help. Joining us live this morning to talk about their new expanded website and how life is changing for many seniors is Amy Schmidt from Retirement Connection. Good morning, Amy.
Morning. Thanks so much for having me.
Absolutely. I think this is really important stuff for a lot of families out there. We want to tell them about this new website called careavailability.com. So tell us what this is and what kind of resources you've put on there for people.
Well, we know that families, when you're in that crisis and you're trying to find, it's not just finding the right fit, but also who has availability at the time. So it was built so that housing, home care, hospice, and home health could actually say like what they could staff, what they had available so that people could find it in real time and try to find that match and hopefully look up brochures and more feedback all at the same time.
Yeah, that would be a valuable tool to have
Mhm.
right now. How has the demand for senior services changed during this pandemic?
Well, sometimes it's really hard to get buy-in for a particular like website or service. But one thing, looking at how senior communities in home cares have really rallied during this time has really been amazing. But getting even the hospitals have really embraced using care availability because rather than having to call somebody in 20 different buildings to see if there is a room available or see if they're taking somebody because maybe they're not able to because they're awaiting test results, they were able to see in real time what was available. And in the senior communities, they're also able to really communicate more in real time with families to say, like, we have this open, we'll have it on Tuesday, and so that they're able to meet the needs at the same time.
Gosh, a couple of my grandparents are in assisted care facilities, and I remember how stressful it was trying to find a spot for them, trying to make sure that it's a good facility that they're going to be taken care of. And that was before we had a pandemic. So I can't imagine what families are going through right now thinking, do we need to move to some of these facilities and is it safe? What kind of information, what kind of questions are people asking you right now?
Exactly that. Is it safe? How can my loved one be managed? And I really have to give a shout out to the housing communities out there. I know it's a really anxious time to think about moving, but in all honesty, a lot of the housing communities and home care agencies really were on the front of this and we're really doing quite a lot before the governor said, before anybody told them they needed to. They really were putting systems in place to make sure that they were caring for like one caregiver would match with a certain group of residents, that residents were being distanced even early on. So they have been very proactive and really creative on how they can still offer activities and socialization. One community actually had a guest yoga instructor Zoom in from India because
Oh,
they weren't
wow.
able to do the regular class.
Yeah, I mean, especially because I think these care facilities, they were the ones early on that started to see the spread. So
Mhm.
they had to figure out how to pivot. Have you noticed a positive shift in the sense of community when it comes to helping seniors?
Absolutely. So many families have been really a part of the community that their parents live in now, making masks, delivering, doing outside window visits. And even several nonprofits, the Alzheimer's Association, as well as Parkinson's Resource of Oregon, have put all their classes online. They've been able to reach a more rural demographic that has not been able to usually participate, and you haven't had the same barriers of parking and transportation. So actually a lot of services have been able to be there even more so and more available because they're available 24/7. And just the families and the communities together with the residents really working together to be proactive on what can be done and how can they do it.
Yeah, gosh, it's nice to hear that there are some silver linings
Yeah.
in all of this, some new positive things coming up here. Well, Amy, thank you so much. We appreciate all the information, and I think it's important stuff to have to make those difficult decisions just a little bit less stressful. So thank you.
Awesome. Thank you.
Yeah.